Hi everyone, in this video today we will discuss colchicine. What is this drug colchicine? Colchicine is one of the anti-gout agent. So this drug can be used both for prophylaxis as well as treatment of the gout. But for the treatment, this drug is considered as second line agent. And this drug is a natural product belonging to alkaloid category. This drug is derived from crocus plant, which is biologically known as Colchicum autumnale. Colchicine is mainly reducing the pain sensation that is going to be produced during the gouty attack. But this drug is not an analgesic. Still, it can reduce the pain as well as inflammation associated with gouty flares. So, this drug is used for prophylaxis as well as treatment of gout flares. So, this drug can reduce the pain associated with gout flares that can be observed at the big toe, hands, and even the knee joints, where it can be used mainly as prophylactic in order to reduce the gouty attacks. Similarly, this drug can also be indicated for another condition, familial Mediterranean fever. So this is one of the autoinflammatory disorder associated with only few of the population, where it is associated with inflammation and fever, which can be controlled by colchicine. So today in this video we are going to see how this colchicine acts, what is its chemical nature, what are the important precautions, side effects, dosage, all these things we will discuss in this video. First of all, it is the chemical nature of this drug. So this is the structure of colchicine. Let us give the numbering here. We can start the numbering from this carbon. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So totally it's having the 12 carbon 3 ring system. And here the functional group is the estamide. So we can write the prefix as estamide, which is attached at the 7th position. Now on the nitrogen of this estamide, this entire ring is attached. So we can write this as N dash. Now what is the name of this ring? Here we can observe these two are the 7-member rings which are fused. So this is nothing but heptadene. This heptadene is fused with the benzene by first position. So benzo-A-heptadene, that is a ring system present in the colchicine. So this benzo-heptadene is attached by 7th position to the estamide. So we can write this as 7-yle. Now we can identify the side chains. Methoxy groups are present at first position, second position, third position, as well as 10th position. So we can write this as 1, 2, 3, 10 tetramethoxy. Then a keto group is present at the 9th position, 9-oxo. Saturation is present at 6th and 7th position, so 6,7-dihydro. Natural saturation is present at the 5th position, so 5H. That is a complete name of colchicine. So colchicine is a benzo-heptadene derivative. Now let us see how this drug acts. Colchicine mainly acts on the immune cells such as monocytes and macrophages. So when there is a stimulation of innate immune response, it activates the NF-κB, nuclear factor kappa B. This can interact with the DNA within the nucleus, which produces gene transcription and protein synthesis. So it can release few of the proteins such as NLRP3. These are the proteins belonging to the NLR family containing pyrine domain 3. Now these proteins can be assembled to produce inflammasomes. Similarly, this gene transcription also releases another mediator pro-IL-1 beta, which is the inactive form of IL-1 beta. NLRP3 proteins can be assembled to produce inflammasome, which is responsible for stimulation of inflammation cascade. Now, in the gout patients, monosodium urate crystals are formed. These monosodium urate crystals can stimulate the NLRP3 pathway, thereby they can increase the formation of inflammasomes. And this inflammasome can stimulate caspase 1 pathway. So, pro-caspase 1 can be converted into caspase 1 by this inflammasome. By activation of caspase 1 pathway, pro-IL-1 beta is going to be converted into IL-1 beta. This IL-1 beta is going to be transported through a specific transporter to the out of the cell, which produce further inflammatory response. In this way, IL-1 beta acts as pro-inflammatory mediator, which increase the inflammation resulting in the pain and stiffness at the joints. Now, colchicine is one of the drugs which acts as prophylactic. It can inhibit the formation of inflammasomes such that it can reduce the release of IL-1 beta. It can also inhibit this NLRP3 pathway. And finally, it can also target the NF-κB, thereby it can reduce its activity. By all of these actions, colchicine can reduce the inflammatory response, thereby it can reduce the attacks of gout. That's why this drug is used as prophylactic. Similarly, colchicine can also act on the microtubules. These microtubules are required for activation of neutrophils. These neutrophils can be deposited within the joints so that they can produce the inflammation as well as pain within the joints. Now, colchicine can bind to the tubulin within the microtubules so that it can produce a depolymerization. Because of this depolymerization, microtubules are converted into free tubules, which results in the decreased release of neutrophils. In this way, colchicine can also control the inflammatory response within the joints. Now, let us see the precautions of colchicine. One of the important precautions of colchicine is that this drug can increase the risk of bone marrow depression, which is also called as myelosuppression. This results in the decreased white blood cells resulting in the leukopenia. It can also result in the thrombocytopenia, aplastic anemia. So all these are very important when this colchicine is used because it can produce myelosuppression. This is particularly more important with other drugs which produce myelosuppression such as anti-cancer agents or immunosuppressants. Similarly, this drug can also increase the rhabdomyolysis. So it can produce a myopathy. When this drug is combined with other drugs such as statins, fibrates, they can further increase the rhabdomyolysis because these drugs mainly produce rhabdomyolysis as one of the important side effects. Similarly, immunosuppressants such as cyclosporine can also increase the risk of rhabdomyolysis when they are combined with colchicine. In the patients with renal failure, the risk of rhabdomyolysis is increased. So in these conditions, colchicine should be given carefully. Similarly, colchicine is going to be converted into metabolites by cytochrome P450 system, and CYP3A4 is one of the important pathway. So if you have the drugs like clarithromycin, ritonavir, ketoconazole, itraconazole, nelfinavir, all these drugs are the strong inhibitors of CYP3A4 enzyme. By inhibition of this metabolism, colchicine levels are increased, which results in its toxicity. That's why along with these drugs, the dose of the colchicine should be reduced. For instance, if the initial dose is 0.6 mg given twice daily, the dose may be reduced to 0.3 mg given as once daily. So dose reduction should be done in conditions of any drug interactions or in conditions of any renal failure. Similar drug interaction can also be observed with the P-glycoprotein inhibitors, where the dose of the colchicine should be reduced. What are the side effects? The important side effects of colchicine are mainly related with the gastrointestinal system. It can produce diarrhea as one of the important side effects. It can also result in abdominal pain, cramps, nausea, vomiting, and even it can produce some pharyngeal pain. All these are well controlled and mainly observed with higher dose of colchicine. How it is given? This drug is available as tablets at a strength of 0.6 mg. So for the prophylaxis of gout, this is going to be started at initial dose of 0.6 mg given once daily. Based on the efficacy of the treatment, the dose can be increased up to 0.6 mg given twice daily. So the total daily dose is 1.2 mg per day. But for the treatment of gout, this drug is given at a high dose. Initially, it is given at 1.2 mg at the first sign of gouty attack, and after 1 hour, another dose is given at a rate of 0.6 mg. Similarly, for the treatment of familial Mediterranean fever, colchicine can be given at a dose range of 1.2 to 2.4 mg per day. So that's about the colchicine, which is a anti-gout agent, which is mainly used for prophylaxis of gout, but it can also be used for the treatment of acute gout flares, and it's also used to control the familial Mediterranean fever. So that's about this drug colchicine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.